My name is Dr. Spriggan. How are you? Pleasure to meet you.
We want to make sure that what we're doing currently is the best treatment for you as a patient, because everybody's slightly different. My name is Danielle Spriggan, and I am a cardiac surgeon. I treat advanced heart disease. So I focus on coronary artery disease, which deals with the arteries of the heart. The other is people with advanced heart failure who need more support than medicines, typically mechanical support. So the predominant operation I do is coronary artery bypass grafting, which is going around the blockages of your coronary arteries, or the arteries on your heart. One of the ways we do that is traditional surgery. The other way we can do it is with a robot. So that's the other thing I do, is robotic coronary artery grafting. They're both very safe options, and it really comes down to preference. There are several advantages to robotic surgery. One is that you're in the hospital for a shorter period of time, typically. The other is that when you go home, you have fewer restrictions. Here at the Lankenau Heart Institute, we're very fortunate that we're able to bring robotic coronary artery bypass grafting to patients. Less than 1% of the institutions around the country are able to do that. We have a very talented group of surgeons and cardiologists here, and we all work very closely together. Every week, we meet with the cardiologists. We sit together and we discuss every individual patient and what the best option for them is. We all put our heads together and think about what we could do to best treat this patient individually. We do have a great set of cardiologists here who deal specifically with patients with advanced heart failure. So they treat patients medically with medications and everything they can. When I get involved is when patients are beyond that stage. So medications are no longer working for them, their heart is still sick, they feel poorly, and we need to consider putting a device in them. And one of those things we can do is a mechanical device that actually assists your heart with its pumping function. I come with the expertise from having trained in advanced surgical heart failure. And patients we're considering for a left ventricular assist device, it's also called an LVAD. That's what I do, that's what I specialize in. One of the things that's very important is that we want to personalize medicine. So that's where clinical trials come into play. This is our way of measuring and finding out specifically if what we're doing currently is the best treatment for you as a patient, or if we should be doing something else. I care very much about my patients. I truly want them to feel as though they are part of our team and part of our family. So my goal is to help you reach your goal. The thing that makes me the happiest is once I've performed surgery on someone, when I get to see them for their first visit. And they come back and they tell me they have more energy, they're no longer short of breath. That means you've made a difference in their quality of life, which I think is very important. They can spend time with their grandchildren or their children or their sisters and their brothers. That's what makes me the happiest.